Hello, my name is Ann Wells. I am an internist and the Director of Prevention and Chronic Care Solutions at Kaiser Colorado. I am here today to make the case for depression screening and treatment in patients with diabetes. Depression increases the risk of developing type 2 diabetes, and having diabetes increases the risk of developing depression. In fact, depression is associated with a 60% increased risk of diabetes. Type 2 diabetes is associated with a 24% increased risk of depression, and depression is associated with increased insulin resistance. Screening for depression and treatment of depression is vital in the care of patients with diabetes. Depression affects patient engagement. In a meta-analysis of 47 studies, people with both type 1 or type 2 diabetes found that depression kept them from seeing their doctor, following a diet, and taking medications as directed. In addition, A1C results are significantly higher in depressed compared to non-depressed patients and show a stepwise increase in relation to depression severity. Depression is associated with increased mortality. A 20-year study revealed that clinically depressed people with diabetes were 3 times as likely to die over that 20-year study. As you can see, depression treatment should be a crucial component of any treatment plan in a patient with diabetes. As stated before, studies have shown a correlation between existing depression and increased insulin resistance, which leads to the onset of type 2 diabetes. And here is your reference. So remember, check your sugar, check your mood. The American Diabetes Association recommends psychological assessment as a routine part of diabetes management. There is specific criteria in which you can diagnose depression. At least 5 of the following symptoms need to be present during the same 2-week period for most of the day or nearly every day, and at least 1 of the first 2 core symptoms, highlighted in yellow, also need to be present. This criteria is depressed mood, significantly decreased interest or pleasure in almost all activities, significant change in weight or appetite, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, indecisiveness or decreased ability to concentrate, and recurrent thoughts of death or suicide. Common themes for diabetes-related distress are feeling that diabetes is taking up too much of my mental and physical energy every day, feeling angry, scared, and/or depressed when I think about living with diabetes, feeling that I'm often failing with my diabetes regimen, and not feeling motivated to keep up my diabetes self-management. Barriers exist to diagnosing depression and treating depression. Depression can be easy to miss. Depressed patients are less likely to go to the doctor. Depressed patients may be unlikely to complain about depression, instead presenting with issues like chronic pain, headache, insomnia, or fatigue. And finally, physicians may be afraid to ask their patient about depression because of time constraints or a lack of expertise in dealing with depression. Several tools exist to screen for depression. They are listed here and not limited to the list here. The most common is the PHQ-9. There are several treatment options for depression. Psychotherapy, which includes cognitive behavioral therapy or problem-solving therapy, and medications such as SSRIs or SSNRIs. Are you depressed because you have diabetes, or is diabetes causing your depression? Yes! This webinar was created in partnership with the American Diabetes Association. And remember, Check your sugar, check your mood. Depression is real with diabetes.